Welcome to seizure training for school personnel. What is a seizure? The electrical activity is caused by complex chemical changes that occur in nerve cells. They're not a disease, but a symptom of many different disorders that can affect the brain. Some seizures can hardly be noticed, while others are totally disabling. What is epilepsy? A neurological condition which affects the nervous system. It can also be known as a seizure disorder. It's usually diagnosed after a person has had at least 2 seizures that were not caused by some known medical condition. How are seizures classified? 3 major groups of seizures: general onset, focal onset, and unknown onset. In generalized onset seizures, both sides of the brain are affected. It includes seizure types like tonic-clonic, absence seizures, or atonic seizures. In focal onset seizures, the term focal describes where the seizure begins, in one area or group of cells on one side of the brain. In focal onset aware seizures, a person's awake and aware during a seizure. In impaired awareness focal onset, a person is confused or awareness is affected in some way during a focal seizure. In an unknown onset seizure, more information may need to be gathered before a diagnosis becomes a focal or generalized seizure. How are different symptoms described during a seizure? Many different symptoms happen during a seizure, and the new classification of the 3 groups separates them simply into groups that involve movement. So for generalized onset seizure, motor symptoms may include the sustained rhythmical jerking motions, or clonic, muscles becoming weak or limp, or atonic, muscles becoming tense or rigid, tonic, or brief muscle twitching, myoclonus. For focal onset seizures, motor symptoms may include jerking, muscles becoming limp or weak, tense or rigid muscles, brief muscle twitching, or epileptic spasms. And then for focal onset seizures, the non-motor symptoms, examples of symptoms that don't affect movement could be changes in sensation, emotions, thinking, or cognition, gastrointestinal sensation, waves of heat or cold, goosebumps, heart racing, or lack of movement. For unknown onset seizures, motor seizures are described as either tonic-clonic or epileptic. Non-motor seizures usually include a behavior arrest. This means that movement stops. The person may stare and not make any other movements. General first aid for all seizure types. The first line of response when a person is having a seizure is to provide general care and comfort and keep the person safe. Always call for the building nurse immediately if one is on campus or another adult, and note the time the seizure activity began. Always stay with the person until the seizure's over. Seizures can be unpredictable, and it's hard to tell how long they may last or what will occur during them. Some may start with minor symptoms but lead to a loss of consciousness or fall. Other seizures may be brief and end in seconds. Always time the seizure. Note the time the seizure begins. Look at your watch and time the seizure from beginning to the end of the active seizure. Know if the student has an emergency medication to take for seizures. Know when to use it and how to use it. This will be in the student's emergency action plan. Time how long it takes for the person to recover and return to the usual activity. Stay calm. Most seizures only last a few minutes. A person's response to seizures can affect how other people react. If the first person remains calm, it'll help others stay calm also. Talk calmly and reassuringly to the person during and after the seizure. Prevent injury by moving nearby objects out of the way. Make the person as comfortable as possible. Help them sit down in a safe place. If they're at risk of falling, call for help and lay them down on the floor. Support the person's head. To prevent it from hitting the floor, a small jacket or backpack can be used to support the head, and don't forcefully hold the person down. Don't put anything in the person's mouth. Keep onlookers away. Once the situation's under control, encourage people to step back and give the person some room. Waking up to a crowd can be embarrassing and confusing for a person after a seizure. Ask someone to stay nearby in case further help is needed. Remember that some students with seizures have an emergency medication to be given during a seizure as prescribed. Well, this medication is given rectally, and so providing privacy for our students having a seizure is very important. Make sure their breathing's okay. If they're lying down, turn them on their side. This prevents saliva from blocking their airway and helps them breathe more easily. It may look like a person has stopped breathing during a convulsive seizure. This happens when the chest muscles tighten during the tonic phase of a seizure. As this part of the seizure ends, the muscles will relax and breathing will resume normally. Rescue breathing or CPR is generally not needed during these seizure-induced changes in a person's breathing. When is a seizure an emergency? We'll always call for your building nurse if you suspect someone's having a seizure. Never send someone to the health office alone if you suspect seizure activity. Call for an emergency medical help when a seizure lasts longer than 5 minutes. One seizure occurs right after another without the person regaining consciousness between seizures. Seizures occur closer together than usual for that person. Breathing becomes difficult or the person appears to be choking. The seizure occurs in water. Injury may have occurred. Or the person asks for medical help. How can you support someone that has seizures? An emergency action plan will be completed on students that their parent guardian reports they have a recent history of seizures. A copy of this will be given to you, their teacher. Know which of your students have a seizure emergency action plan and know where it is and have it available for your substitutes as well. Know if the student has any emergency medication to give during a seizure, where the medication is stored, which is usually the health office, when to give it, and how to give it. If you notice any suspected seizure activity, note the time the seizure activity starts and contact your building nurse. The building nurse will bring any emergency medications. The parent should also be promptly notified. Be sensitive, supportive, and ask others to do the same. Seizures can be frightening for the person having one, as well as for others. People may feel embarrassed and confused about what happened. Keep this in mind as the person wakes up. Reassure the person that they're safe. Once they're alert and able to communicate, tell them what happened in very simple terms. The individual may be very tired after having a seizure and need a place to rest and sleep for a block of time. Offer to stay with the person until they're ready to go back to normal activity or call someone to stay with them. Again, always promptly notify the school nurse, the adult in charge, and the parent guardian. Thank you. Be sure to contact your building nurse for any further questions.